Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Friday, May 29th. Today we are joined by Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. At the end of their presentation, we will go to the phone lines for questions from reporters. We will call you by name and you will each have one question plus one follow-up. Our French-speaking journalists are encouraged to ask their questions in French. With us today is André Boursier from the French Language Services Directorate to translate those questions for those who do not speak French. Following this presentation, we will go to the virtual town hall. Thank you. Premier Silver?
Thank you very much, Pat. And thank you, everybody, for joining us here on the traditional territory of the Kwalindun and the Ta'an-Quachin Council. As Pat mentioned, this afternoon it's going to look a little bit different. We will begin with a media briefing and proceed to the town hall with questions from the public after that. I will speak very briefly so that we can get into the questions quickly. Yukon is firmly in phase one of our Path Forward plan. This week saw the reopening of personal services, businesses, and today restaurants can offer dine-in services again. As of June 4th, all Yukon territorial parks and campgrounds will be opened and Yukoners can get out and enjoy these recreational facilities. Campers, be respectful as you travel through communities and follow the guidance issued by the communities, please. We have released our new guidelines for responsible travel within Yukon, which were developed with input from communities and can be found on yukon.ca. If you're going camping, prepare yourself with all of your supplies and food that you need for your stay. Take extra precautions to clean and to sanitize surfaces, to wash your hands. Limit your gatherings to your family bubble or groups of 10 or less, and please stay 2 meters apart. In our current phase, travel to communities is no longer limited to essential purposes. What that means is that you can travel throughout Yukon, but please do so responsibly, following the guidelines released today. Each community is taking steps to ensure that they feel safe and prepared for visitors, and we ask Yukoners to stay informed and be respectful of the community's wishes. If you are traveling within Yukon, we will still like to ask you to ensure that you have adequate supplies and are prepared to travel through a community efficiently. As you will see in the guidelines just published, you may shop in local stores and buy food in restaurants as you travel if they are open for your business. But please do not linger unnecessarily outside shops or in the communities if you do not have a specific purpose for being there. Most of all, continue to practice the 6 steps for staying safe. The changes that we have seen recently are important steps on our Path Forward plan. We are monitoring the impacts of these changes, specifically to see if there's a resurgence of COVID-19 cases. If all goes well, and if there is no change in Yukon's infection numbers, we feel that by June 15th, we will be able to begin moving towards Phase 2. We are on track to begin Phase 2 of our reopening plan by July 1st. This timeline is fully endorsed by the Chief Medical Officer of Health. We are confident in our healthcare capacity, in our ability to test, and our ability to track and contain this virus. It is that confidence and all the skills that we have gained in the past 2 months that allows us to begin to move to Phase 2 of this plan. Yukon's Chief Medical Officer of Health is confident that when we do transition to the next phase, we will also be able to lift restrictions on travel to and from British Columbia, which would allow for the free movement of Yukon and BC residents back and forth with no requirement for self-isolation. We are working towards being able to lift these restrictions between BC and Yukon by July 1st. We continue to monitor other jurisdictions to determine if it is safe to lift travel restrictions, and we will share that information if and when it becomes available. Now, lifting restrictions, travel restrictions to British Columbia is possible because of the epidemiology of COVID-19 in that province and in our territory. It is not only a question of geography. It is based on science, careful risk assessment, and our confidence in how British Columbia is managing this pandemic. That confidence comes from our long-standing and close working relationship, particularly in the public health field. I will ask Dr. Hanley later to speak more on his part on that. Phase 2 will also see a number of other challenges, a list of other changes for allowing for outdoor social gatherings of up to 50 people and expanded dine-in capacities for restaurants based upon public health assessments. As we continue to monitor the progress of the virus nationally, we will consider exceptions for essential workers traveling from regions where the virus is contained and spread is minimal. Now, prior to lifting these travel restrictions, we will continue to work with communities, municipalities, First Nations governments to make sure that they are comfortable with visitors in their communities and that they feel safe. This is an important part of moving ahead with these changes. Our announcement today fits with our gradual and phased approach to reopening that focuses on protecting our communities, our most vulnerable residents, and on minimizing the risk of exposing Yukoners to a local wave of this virus. As always, we will continue to provide updates as we move forward. We know that recovery and a return to normalcy is on everyone's minds right now. So too is Yukon's desire for their communities to remain safe. We must remain diligent in the fight against this virus. This diligence falls to each and every one of us as Yukoners. We saw this week how dangerous it is if people do not follow recommendations. In New Brunswick, the actions of one individual who traveled and then returned to work without following the recommendations has now caused a return to more severe restrictions in his community. We do not want to see that here. We must balance the fact that we can't be too strict for too long for the sake of our mental health and our societal and economical well-being. So long as we continue to practice these 6 steps to staying safe, we can confidently progress through the next phase of this plan. As we begin relaxing health measures and reopening society, it remains a very real possibility that strict measures will be needed to be reinstated. We should all be very conscious of this reality. We need to remember that this is not a sprint, it is a marathon. And we need to remain diligent in taking personal responsibility for staying safe and practicing the Safe 6. While we are working towards how our territory adapts to living with COVID-19, COVID-19 is not going away completely anytime soon. We must adapt to a world where we can live safely with this virus. We thank everyone for their cooperation and for making so many sacrifices. Because of the hard work that you have done, we are able to be in this absolutely fortunate position that we see ourselves in today. Thank you very much. Dr. Hanley.
Thank you, Premier. This is an exciting day for all of us. As the Premier mentioned, we are on track to begin phase 2 of the reopening plan by July 1st. And I am confident that if we continue on this current path, we will be in a good place to move our territorial plan forward. We've received a lot of support from many individuals to allow us to start moving our territory slowly, deliberately, gradually forward. During our response to COVID-19 over the last couple of months, I have been thinking and saying often about the unintended and additional effects that this disease and our response has had on people's health and well-being by affecting people's workplaces, businesses, incomes, social networks, education, and many of the other societal supports for healthy living. Some changes brought on by COVID-19 restrictions have brought benefits such as increased innovation, and for some, increased family and community connectedness. But we know that there have been adverse effects on individuals and communities. We've heard from frontline providers there's been an increase in harms related to alcohol and other substance use. I'm concerned about those who are homeless and vulnerably housed, children living in families at risk, families with domestic violence. And I'm worried about patients when medical care is delayed either by themselves or the healthcare system and the ways that this can affect their health. I'm concerned about those who have lost secure income due to changes in the way we are living. In fact, many people and businesses, especially those who depend on outside visitors, are close to financial ruin or desperation. And we sense increasing public unrest at keeping distant from each other. There's also a toll of domestic violence for some who are shut in against their will. And there are families who are kept apart even in these times of need. We have started gathering data to more formally report on these unintended consequences of being shuttered down. Other jurisdictions have begun to document changes in people's health and wellness due to COVID-19, including increased alcohol consumption related to stress and boredom, decreasing immunization rates, worsening of chronic health conditions due to unmet health needs. Locally, although we've noted a drop in overall visits to the emergency department since early March, at the same time we've seen more visits for overdoses and mental health concerns. And it was only a short number of weeks ago that we had to announce 7 drug-related deaths since January 2020, including 4 deaths in March and April related to fentanyl. EMS have noted similar increases in calls for alcohol intoxication and overdoses and mental health reasons. The RCMP have noted an increase in assaults, domestic violence, possession and trafficking calls, and increases in calls related to the Mental Health Act. In summary, I'm increasingly concerned about the overall health and wellness of our territory. So as we go forward, I am looking for opportunities to alleviate some of this building pressure. So this is the time to look at our plan for easing border restrictions as part of Phase 2 and beyond. Phase 2 has had that language about creating exceptions to our border closures, so we have done some thinking and listening in that regard. As I've stated to media before, and to you, the public, my advice to government has always been that we need to be prepared to open borders gradually when we are confident that the risk of importation of COVID is low. As you know, BC has demonstrated successful flattening of the curve due to their strong public health response. As we look to exceptions in border restrictions, it makes sense to intentionally partner with British Columbia by opening our Yukon borders to more travel between BC and Yukon. This will allow Yukoners to travel to BC and return without having to self-isolate, and allow BC residents to travel into Yukon, whether for business or for pleasure, without the need to self-isolate. A border check-in process will still occur to ensure that the BC folks have not been out of their province in the previous 2 weeks and otherwise are informed at the border of all the important measures we have in place, including the Safe 6 measures to observe. Choosing BC is fitting given our existing partnership with BC in so many areas, not the least of which is our ongoing public health partnership. For many years, we've had a close relationship with BC's healthcare system, and in particular, my office has a strong partnership with BC Public Health and their many teams, including their special laboratory at BC CDC, their epidemiology unit, many of their public health policy units, and my own collegial relationship with Dr. Bonnie Henry as my counterpart in BC. But let's not kid ourselves. Just like any of our opening measures, any relaxing of the borders will involve taking more risk with COVID. On the other hand, we know that we can handle COVID as long as we are observing public health measures, most notably the Safe 6 measures, and protecting those who are most vulnerable. None of us wants to get behind with community spread, and if we all do our jobs correctly, we can prevent that from happening. We still could get cases or clusters or outbreaks anytime, But I feel that we're in a very good place to be able to handle cases of COVID should they arrive, and that includes cases in communities or in Whitehorse. Getting through this pandemic means taking calculated, smart, and perhaps bold risks. If we carefully relax our borders, we will open up a way to provide relief to people suffering under the current measures, whether that means more customers, access to goods, a safer drug supply, or a chance to connect with friends and family. Our cost will be a higher risk of COVID coming in. This is not an easy decision to make, but it's the right decision to make for the sake of all of us. It means we will continue to test for and look for the disease. We'll need to keep closely observing COVID activity in the rest of the country so we can keep track of the risk of importing cases. We will continue to work very closely with our partners in BC to stay on top of the epidemiology. It will mean the public has to work with us to keep observing the Safe 6 practices. It means we will be as transparent as we can be about sharing information. It means that if the risk of cases in BC gets worse again, or if we get more cases than we can handle, that we have to go back to more restrictions. That could even involve closing borders again. We will be working on details of how we promote and monitor this change. For example, we intend to ensure that people coming from BC will not have been in contact with known cases and will not have been out of the province in the previous 2 weeks. We may also require people arriving within the previous 2 weeks not to visit more vulnerable individuals or long-term care sites. As another example of border exceptions, over the next 4 weeks, we will be working directly with industries such as the mining industry to allow them to select low-risk mining workers to be able to self-isolate on site at the mines under strict supervision and protocols. These are the areas that we'll be focusing on as we prepare for Phase 2 over the next 4 weeks. Part of this gradual approach involves a philosophy of gradually moving away from enforcement to persuasion and education. Enforcement increases stress, and stress increases so many other areas of well-being. Whether we're applying good public health principles or sound governance, we should always be obliged to use a proportionate approach. And that's one of the principles of our go-forward plan for Yukon. And we need to use the least onerous methods to achieve our goals. It's only an hour ago that we talked about the border opening plans and the BC connection with Yukon's chiefs. And only 2 days ago that the Premier and I talked about this particular approach of partnering with BC and the timing for Phase 2. Things are happening quickly. Many of the chiefs expressed concerns for very understandable reasons. And my advice to them was that there is no easy way forward. Any choice we make at this point carries risks. But the lesser overall risk to people's health is in the approach I'm advising for Phase 2. What I did again commit to was for me and my team and for the Yukon government to work with the chiefs and communities over the next 4 weeks to make this plan as safe and as trustworthy and as effective as we can. So I hope that we can all work together on these next phases so we can ensure that everyone has the supports they need and the information they need to observe the measures that we need to take, particularly, as the Premier said, in observing the Safe 6. As the public, you have a major role to play in this. It's up to all Yukoners to help to make this idea work, to improve our well-being overall, while protecting us from what we know COVID can bring. From this point onward, the safe rules of conduct will be increasingly important until we can be assured of protection from vaccine. That's all for my update. Thank you.
Thank you, Dr. Hanley. Thank you, Premier Silver. I will call on the reporters. We appear to be having some trouble with the phone line, so I will call your name, and If you can't hear me or we can't make yourself heard, we are working on another way for you to get through. We'll start with Gord from the Yukon News. Is the line completely down? Sorry about that, folks. The line is completely down. Okay. So in light of that, what we'll do is we will move to the virtual town hall, and when we get the phone lines back up or a way to ensure that the reporters can ask their questions, we'll go back there. So we had put out a call last week for the general public to submit questions that Premier Silver and Dr. Hanley would answer. We had more than 130 questions submitted. We've been able to theme those into about 10 different areas. Obviously, we can't answer all 130 today. So we have chosen one representative question from each of the themes. And the other questions we have committed to finding answers for them and posting the answers online, probably not till next week, but we will do a sort of a virtual town hall Q&A. So you can, if you don't hear your question asked today, check for it online next week. I'm joined this afternoon by Matthew Cameron from the Cabinet Office, who is going to share the questions with me so that I don't have to talk for very long. And Matthew's actually going to start us off. Matthew?
Thank you, Pat. Our first question centers around childcare. The question goes as follows. Yukon government's COVID-19 response included providing childcare at no cost to Yukon's essential workers, which is quite a lengthy list of occupations. Has this brought up the discussion within YG about the importance of affordable childcare in our post-COVID world? What does YG intend to do to help fund childcare now that YG has demonstrated the high importance they place on our childcare facilities and workers? That's the thrust of the question, but there were also some related ones about how many children can be at childcare facilities now and how vulnerable children are to COVID-19, as well as how cohorts are working for small groups of children in these facilities.
Thanks very much, Matt. We know that childcare is an incredibly important part of all of our communities. Early childhood educators and childcare operators, they're extremely essential to ensuring that Yukoners can go to work every day and that our children are taken care of, they are nurtured, educated at the critical stages in their lives. In early April, our government announced that we would be covering staff wages as well as eligible business expenses, including rent, utilities and cleaning costs for childcare centers and also for family day homes. This was to help the care operators to adapt to the new realities that we are facing here under the COVID-19 days. Our government was also proud to increase funding to childcare operators for the first time in a decade in 2018. This increase in funding included additional support for rural childcare programs and is part of our work to make sure that children have access to affordable early learning and also childcare. Our government is committed to supporting childcare operators because we recognize that they are vital to keeping our community strong and resilient. Now, going forward, we will absolutely be looking at what kind of childcare supports that we can have for the operators across the territory, making sure that we keep an eye on providing them that quality care and that they can provide the quality care for the kids and early learning opportunities, not only now, but also into those future generations for future Yukoners as well.
Dr. Hanley, if you could address the cohort issue, please.
Sure. So, well, probably a few things I could say, but the way that childcare is working in the COVID climate is around cohorting of small children, recognizing that that small children cannot safe space in the traditional way that we think of it as being 2 meters apart. So the solution around that is to limit children to smaller groups with one daycare attendant at a time. So in that way, you're keeping groups of kids apart from each other. The other part was about susceptibility of kids to COVID-19. As we know, children do get COVID-19. I think Quebec reported 44 cases amongst school children so far since return to school, which is actually quite a low number considering the number of kids that were going to school. So it does show that kids do get COVID less frequently than adults and less severely than adults. And also, they don't appear to be as effective at transmitting disease as adults and adolescents.
Thank you. So the next question is, I have heard that there's an active case of COVID-19 in the town of Atlin. I was wondering, being that Atlin receives most, if not all, of their official services from the critical services from Yukon, are they being counted in our current numbers? And does this now confirm that we have community spread if the individual affected did not travel? I know Dr. Hanley does not release names of communities or individuals, but if there is a confirmed case down there, and being that it was stated that northern BC communities are being treated as part of the Yukon, what is in place for medical aid for those communities should they have a large-scale outbreak?
There are many interesting questions wrapped up into that one question. First is that I'm not apprised of a case in Atlin. Normally, we would be apprised of a case in Atlin through the northern region of BC Public Health, and so I'm not aware of a case in Atlin. Now, if there were a case, how would that play out? Might be the more important question. And one thing in that question is, does a case in a community mean that there is community spread? And of course, those are two different concepts. So if there were, for example, a case in Atlin, then it would be a matter of whether that case can be traced back to an identifiable cause, identifiable place. So, for example, someone who traveled into Atlin traveled through Whitehorse, which is, of course, the way to get to Atlin, and but came from another area, and therefore was effectively an imported case. So if that case were then appropriately isolated and with a confirmed source, then that would not be an indication of community spread, and it would not change. It would be similar to the case that we had in one of our communities, where the case was appropriately identified, contacts were identified and isolated, a source was confirmed, and therefore there was no indication of community spread or any increase in public risk, and that's been a pattern with all of our cases. So I guess to make a long story short, a case in Atlin would not necessarily change anything about our particular bubble with Atlin or our approach. Now Atlin is administratively in the public health region of BC, so the reporting would be through the northern BC public health reporting. It would not be reported as a Yukon case. It would be if that person needed medical attention beyond the health center at Atlin, then Whitehorse would be the appropriate place, and so that health service would be afforded in Atlin. And in terms of if there were an outbreak, if we were asked to assist with an outbreak, we would, of course, be cooperating with the Northern Public Health in organizing that outbreak response.
Thank you, Dr. Hanley. The next question has to do with travel into and through the Yukon. The question goes as follows. My biggest question is around the people we are allowing to travel through Yukon and minors who are coming in from outside the territory. The total trust in an honor system that they will not stop at grocery stores or anywhere else seems to not be working, judging by the number of U.S. and other out-of-territory plates being seen around town. We will never eliminate COVID locally if we are steadily letting in people and not really monitoring whether they're following rules that are in place to keep the community safe. Is there a way that this can be better monitored with random spot checks on people's whereabouts? Has the government been monitoring this at all to ensure the honor system is working? And then related to this, there have also been questions about how long the 14-day self-isolation period for those entering the territory will remain in place.
Thanks, Matt. Thanks for the question. It's a great question. We are educating travelers as they enter and asking them as well as they pass through to do so within 24 hours on their way to their destination outside of Yukon. We have enforcement officers in Carmacks, Mayo, Dawson City, Ross River, Faro, Haines Junction, Old Crow, Teslin, and Watson Lake. The RCMP remain available to support enforcement in all communities. Those enforcement officers are informing travelers about the requirements and may issue fines. They can issue arrests as well if they are finding people that are violating the CEMA orders. That's the Civil Emergency Measures Act orders. We have a call-in number as well where Yukoners can report concerns, and that number is available on yukon.ca. We also have set up roadside information stations outside of Whitehorse to ensure travelers in transit through Yukon understand their mandated route through the territory and also the restrictions that are in place under CEMA, the Civil Emergency Measures Act. We need to keep in mind that the Alaska Highway is absolutely a major transportation link that is connecting the continental United States to Alaska, and many people are on their way to Alaska to work in critical and essential roles there. And I do appreciate that there have been a lot of vehicles with outside license plates in our territory, but that's not necessarily a good indication of whether the individuals are following current guidelines that are in place or not. Our efforts to provide information and education about the CEMA orders have been very successful in achieving compliance and also understanding, ensuring that both Yukoners and people entering the territory as well follow the guidance of the COVID that COVID-19 has made necessary. So we will continue to work with our community partners to keep the territory safe and healthy. Now, in terms of the 14-day isolation, as we mentioned earlier in the update, we are looking towards entering that phase 2 of a path forward on July 1st. And if things go well through June, this will include a mobility bubble, if you will, with BC that will allow residents of Yukon and British Columbia to travel back and forth and without the requirement of self-isolation. So again, this is based upon epidemiology and risk assessment with respect to British Columbia. The considerations about increased mobility will continue to be guided by epidemiology and also risk assessment and also the recommendations from Dr. Hanley and his team.
Nothing to add? Okay. We'll move to the next question then. This question is on testing and tracing. A strategic regular testing program for those with the most exposure to COVID-19, such as border guards, health workers, and others whose jobs involve contact with large numbers of people, would be a cost-effective early warning system for arrival of the virus in Yukon. Given the success of such proactive testing and contact tracing in other places where numbers of infections are low, has such an approach been considered here, and what measures are being implemented? Supplementary question, we also had some questions about the future of vaccine for COVID-19.
Well, two different areas, but we'll try to cover it all. We are continually looking at our testing strategy and revising it as we did a couple of weeks ago. So we are in a very good position in terms of our testing capacity. What our focus is on risk of importation, because all of our cases have been related to importation, and that was the reason behind our expanded criteria that were published a few weeks ago for importation, and then some other areas of proactive, what you might call proactive testing. So testing for people who are presenting with respiratory illness, acute onset respiratory illness. without other obvious cause, even if they don't have a travel history, as one of those very low threshold approaches to testing, as well as some of the surveillance testing that is being carried out in the vulnerable sectors, like at the shelter, and then a whole regime around how testing is done with a very low threshold for long-term care. Again, one of our sites where, of course, people are more vulnerable to COVID infection. Contact tracing is another area, so we have, when required by cases, that's where the contact tracing kicks in, which involves a regime of testing specifically around that. So this approach has been successful. It's appropriate for our population. Were we to entertain other parts of testing, like kind of random healthcare worker testing, or some of the positions identified, that brings up the limitations of testing. So testing asymptomatic people, apart from very kind of prescribed circumstances, such as test asymptomatic as part of contact tracing in certain cases, or in outbreak situations, in sort of general public, has not been demonstrated to really add anything, and in a low prevalence area like ourselves. So we would have a high false positive rate if we were to carry out testing, and it would just bring us down, divert really our public health capacity into not very useful areas. So at the moment, it's a testing strategy that works for us, and it's able to keep us ahead of the curve. The question about vaccine, there are probably questions about perhaps, I haven't seen the actual questions, probably about vaccine availability. Of course, that remains an international, a hugely important and rapidly evolving international pursuit of a vaccine. There will likely be many candidates. Ultimately, one or more will be chosen as best candidates. An international and a national prioritization framework will be developed in months to come, based on estimated supply, and we, of course, will be part of that conversation.
And just to add to that, on the conversations that I've been having with the federal government and my colleagues across the provinces as well, the conversation about testing is becoming increasingly more important, and also immunity conversations. We know that there's an immunity task force that was initiated from the Prime Minister, I believe, in April 23rd or around there. So that conversation is continuing as well. In that conversation, we talked a lot about prioritizing populations. We talked about prioritizing northern populations and populations of Indigenous communities as well. So that conversation is definitely topical. And I know the Prime Minister does press releases after those conversations, so that information is available online. As Dr. Hanley said, the conversation when it comes to testing and tracing, it's obviously a very critical issue in places like Ontario and Quebec, where there still are high cases, high numbers. We're very fortunate here in the Yukon because our cases have been kept low, and we continue to take those precautions to ensure that we can manage any cases that may occur in the upcoming weeks and months. I think on this conversation as well, as we look forward to immunizations, as we look forward to conversations about vaccines, we really want to make sure that at this point, as we have that conversation, that what's really important now is that people are following the Safe Six, including monitoring of their own symptoms as well. That's what we can do now. We also have self-assessment tools that are available online if individuals in Yukon want to, if they have any concerns about their symptoms, and also for more information or contact, there's 811 to call as well. But really important right now as we look towards a future and look towards the science coming up to some solutions that we remain safe here and now.
Thank you. The next question has to do with substance use. And it goes, the intensive live-in treatment program from Substance Use Services for March, April, and May have been canceled. As of now, clients who have been on a long waiting list do not know when and how the program will be offered. As well, all other programming has been canceled. Meanwhile, the detox center remains open. What is the Department of Health and Social Services planning with respect to live-in treatment for clients that have been waiting, and when will it be running and offering services? The second part has to do specifically with drug abuse. Fentanyl still takes lives and affects many of our kids and citizens, whether fatal or not. With borders being closed and staffed with enforcement, how can we still see the level of illicit drug coming in from other provinces? What is being done between the Department of Justice and the RCMP to control the arrival of such substances in our territory during this pandemic? What is being done by the various departments to address the issues of fentanyl and illicit drugs? And then related to these, there's also questions about mental health services being available in the territory.
About service.
Fentanyl or whatever.
Oh, you want me to take that
Sure,
first?
yeah.
Okay, so I'll address the drug question first. Again, a lot of that is around enforcement, and I would say not really speaking directly for enforcement. One answer though is the enforcement, of course, that's presently at place on the borders is enforcement that's aimed at travelers coming in and where they're coming from, and so it's really targeted enforcement around the SEMA orders, and not specifically for drug supply, possession of drugs, which would be different people, different skills, and different requirements. Now, what I do know, though, and as I maybe hinted in my opening remarks, was that we know that the usual drug supply that, however it makes itself in, is likely being affected by present border restrictions. So almost like the reverse question, and we know that there has been disruption in perhaps preferred pathways of drug supply, which has meant or which has likely resulted in some abnormal patterns of drug use and dangerous or even more dangerous patterns of drug use in the territory. People doing more manufacturing locally, having supplies from sources that are less familiar, taking drug combinations that are not known to them. I've heard of use of more methamphetamine, and as I said, we have seen more overdoses. Whether that's related to this or not, we don't know for sure, but definitely disruptions in drug supply. So, I mean, the question is a good one, but it really relates to how do we do federal policy around drugs and criminalization of drugs. How are we looking at a safer drug supply in general? How are we ensuring access to treatment and to substitution opioid agonist therapy for people who need it? Are they getting the information to be able to access the resources that are presently available? So it's a really multifold answer, but as I noted, I am concerned about the number of overdoses and the number of fentanyl-related overdoses that continues to plague us. We've seen this in the rest of the country. We've seen this even in BC. Recently has reported another spike in opioid overdoses. So this is a national problem, and as neighbors to BC, I think it's something that we also experience disproportionately.
I can speak to the supports available in this question. This is an extremely important issue, and I understand that Health and Social Services is working towards resuming the live-in intensive treatment program end of June, beginning of July, and there are new infection control measures that need to be put in place to manage the risk, and that work is happening now. Substance use is a serious issue, and it didn't go away because of COVID. And if anything, it's compounded. The ongoing public health crisis is related to high risks, high rates of illicit drug use, and deaths, and acute harms from substance use. So it's an extremely important issue for the government to stay on. Opioid treatment services are available through the referred care clinic. No referral is required. There is also an opioid overdose prevention coordinator available to provide naloxone training and also naloxone kits for individuals, as well as harm reduction education and supplies. In the community hubs, which are extremely important in this fight, amazing staff, have provided harm reduction education and supplies. We have outreach nurses that are working with marginalized populations where needed on a daily basis. Thank you to them for their ongoing work. Blood Ties 4 Directions offer harm reduction services as well, including fentanyl testing in Whitehorse. That is Monday through Friday from 8:30 in the morning until 5:30 at night. And I know that Dr. Hanley and his team offer harm reduction services as well, including fentanyl testing in Whitehorse, again at the same times, Monday through Friday, 8:30 in the morning till 5:30 p.m. Or actually, I think that's just through the emergency shelter as well and the referral clinics. They're also beginning to begin those fentanyl testings at those locations. So there are also continued mental health services available for Yuconners through the mental wellness hubs and the substance use hubs that are in Dawson, in Carmax, in Haines Junction, and in Watson Lake. Many services have been provided over the phone and online in the past couple of months. Face-to-face counseling is also still happening on a case-by-case basis. And I know that with the spring weather arriving here in the territory, there has been more of the more walk and talk sessions, I believe they're called, that are happening outside, which is also very important. But the mental health of many Yuconners has been impacted extremely by this pandemic, and we need to ensure that we are looking out for one another, checking in on one another, and also taking time for ourselves as well.
Right. Our next question. After over a month of no positive coronavirus cases, with no deaths and no hospitalizations, how long can you justify keeping the Yukon in a state of emergency? Subsequent question to this was, while we are in COVID-19 times, how should people be handling elections that are coming up? So two different questions, but...
Okay, I can start. Good questions, plural. We're currently in a state of emergency until June 26th, according to the Act. We will evaluate whether or not to extend this based upon discussions, obviously with with Dr. Hanley and his team, and also others, and developments in other jurisdictions also. That's really important as to whether or not we continue those orders here in the territory. The Civil Emergency Measures Act, it does give us the ability to be more responsive and to act quickly in response to the ongoing situations that we do find ourselves in. It also gives the government the authority to enforce these orders, such as the border restrictions, the fines for not following the orders, that kind of stuff. It's a key component of our response to the pandemic. There's no doubt about that. Now, all the actions that our government has taken under CEMA are to protect the health and the safety of Yuconners and support them through these challenging times. We continue to act based upon the recommendations of Dr. Hanley and his team. They continue to evaluate the epidemiology and risk assessment of other jurisdictions, which is extremely important as we look at our controls to make sure that we make those responsible decisions for Yuconners.
Well, I can just add quickly that in addition to what the Premier said about the state of emergency, it really is, yeah, I agree it gives us those tools to be able to put in place all that we have put in place, also to be able to ease off gradually, as we've been talking about. But it's not, again, the emergency is not based on what we have in territory. And reminded, we actually declared a public health emergency before we had any cases. So it really is around what we anticipate and what are the risks. A lot of it is around importation risk. So when we're all, so as a country, when we're all comfortable that we are no longer at risk of significant COVID circulation, we'll obviously be in a much better place to reconsider those. As Premier mentioned, it's also a matter of being in coordination with other jurisdictions. But it really is a matter of what is the risk? What is the risk as we look to a second wave? What are the tools that we need to manage that risk?
Thank you. The next question is about long-term care homes. CBC News reported that over 70% of COVID-related deaths were from long-term care facilities, and as of April, 90% of deaths were of people over 60. Based on these hard facts, why isn't this now the focus here in Yukon rather than continuing to target everyone?
Those are very hard facts, and we did take some very early actions to protect residents living in our long-term care homes. I want to reassure Yukon families that Yukon facilities where your loved ones are, they're very well run, and they're being very well cared for, and they're safe. We have 5 long-term care facilities in Yukon, all of which are government run. They're not for profit. We are very fortunate that nearly all of our long-term care's homes have single rooms. This is a significant advantage that we have over other jurisdictions should we need to contain an outbreak. And as always, the Continuing Care Division continues to work very closely in partnership with Yukon Communicable Disease Center and the Chief Medical Officer of Health's office on infection controls and practices and in the pursuit of managing a potential outbreak. Again, this is extremely important that we took early actions to make sure that we protect our residents that are living in long-term care because they are some of our most vulnerable citizens. This includes restrictions of visits to only essential visitors in all of our long care homes. The essential visitors are screened before every visit. Staff are working to keep residents active and engaged. They are doing amazing work. We are so lucky to have the level of professionalism that we do have in our long-term care facilities. We are providing a variety of recreational activities and programming and facilitating virtual visits, window visits, these things to support the families and to support the residents. The employees managing these facilities, again, they are very committed to the well-being of our residents. The staff are required to stay home if they're feeling sick, and staff moving between facilities is very limited. Extra training is also being provided to staff on correct use of PPEs, personal protection equipment, following our existing policies and our procedures there as well. So we've established measured controls to safeguard and to monitor the use of those protection equipments, those PPEs, just to make sure that we have enough available to continue to manage the current situation and to prepare for whatever may come in the future.
Yes, I have a few things to add on that. One is that we were in a very fortunate position in the first place to have publicly owned and operated long-term care homes that were also single-room facilities. So already in a good position, already with well-rehearsed outbreak protocols for respiratory illness. And clearly, we did, as we learned more about COVID, recognize the disproportionate burden that has been taken on the elderly, particularly long-term care residents by COVID. So very important as we proceed through the opening phases that we reinforce the protections to our long-term care. So even above what our baseline was, we've, as the Premier mentioned, been doing a lot of work to put in the extra protections necessary. But of course, long-term care is not the only source of severe illness or fatalities that we've seen globally. So of course we have to address the risk to other vulnerable sectors of the population that are not in long-term care. So that includes, elderly people who are living individually or in other types of settings. and other people with underlying medical conditions, and whatever their age, especially adults. But if you have enough circulation of COVID, you will see complications all over the place. And even though those complications are disproportionately more frequent the higher you go, we do see complications in younger people as well. You will also have heard about, for instance, the inflammatory syndrome in children that's associated with COVID, as well as with other viral illnesses, Kawasaki-like syndrome. So it's not to underestimate the effect that COVID can have on a population as well. So again, we need a proportionate response to proportionate risk, and we can't be oblivious to the risk that's outside of long-term care. But we still need to strike that right balance, which is why we are proceeding through these reopening phases.
Thank you. The next question comes from a grade 7 student. If I attend a summer camp, can I be within 2 meters of my friend, also my cousin, who's part of my family bubble? And is there any chance that over the summer I can have overnight camping trips with our summer camp?
These are really important questions. So, and I don't have all the answers to those questions yet, but we are working on answers to that. I would be quite comfortable with a bubble arrangement, a family bubble, a friend, cousin that is already part of the family bubble, whether that's within the household or one of the two household bubbles. It would be like a brother and sister attending camp, for example, and they would be able to form their individual, to keep on to their individual bubble or their combined bubble, if that were compatible with the rest of the planning for the camps, which is going to be very individualized according to how the camp is being set up. So in principle, that could occur, but it really might depend on some other factors that are not primarily health or public health reasons. So definitely something to get specific advice on. What we are doing is we're reviewing a number of plans for camps, and then providing commentary so that camps can proceed safely as possible. As far as overnight camping trips, we have not reserved judgment on that. We're still reserving judgment, I should say, on whether at what stage we can permit or endorse overnight camps. And again, it might depend on exactly when, the number of people, who's involved, where it's going. But we're being very careful about that at the moment, and have not at the moment put ourselves in a position to endorse overnight camping. A little bit of a higher risk, and so we're looking at that as a later phase activity, but more on that as we get towards finalizing our sports and rec guidelines.
Excuse me, we did have a number of questions around sports activities that may take place this summer. A lot of them were specific inquiries about individual sports. Can you tell us what's going to happen with sport and recreation activities over the summer?
Yeah, so we do have, I believe we're going to be posting our sport and rec activities guideline very shortly, if not today. And we have already reviewed a number of plans for particular sports and rec activities through our risk assessment decision, or our RAD team. We're reviewing a number of these as quickly as we can, based on plans that have been submitted, and some very interesting plans. So lots is already going ahead. We're in what we're really doing in terms of sports and recreation activities is looking for ways to proceed with activities or sports that do not involve a close contact. And we've had many interesting and innovative examples submitted to us of how people are going ahead with, it might be drills, it might be sports like exercises, it might be more limited cohorts of people at a time. But I think the best thing is look at, if you're planning an activity, would like to submit an idea, look at the guidelines first, make sure that it's compliant with all of the safe measures that we're recommending, and give us your plan. And we really do our best to support or suggest ways to change things so that the activity can go ahead.
Thank you. The next question has to do with masks, and it's sort of a two-parter. Should masks be worn by members of the public? And do masks need to be worn by personal service workers and their clients?
Yeah, so this is definitely a common question. And often, obviously, it's one that's much in the news, and it's also one that has gone through various iterations of recommendations at federal level, and that's been based on both evolving epidemiology and evolving evidence, and just increasing understanding of where masks may play a role. So these are non-medical masks. So really the best evidence for use of a non-medical mask is kind of like covering your sleeve, a similar thing to covering your sleeve when you cough or sneeze. It really is another measure to help to prevent transmission of something that you are carrying, like maybe you have an early respiratory infection, you're incubating COVID, for example, and it prevents you from sneezing into a room and creating droplets or coughing. It's very important that a mask not be interpreted as a replacement for physical distancing. So it's not part of our Safe 6 for a good reason. It's like an extra tool, and it's really for those situations where physical spacing is not possible. That is a rare circumstance, fortunately, in our jurisdiction, and that's why I'm not actively recommending masks. Based on our epidemiology, and the lack of COVID circulating in our community, there's really little reason to justify use of a non-medical mask in public. When you think of more densely urban areas where it may be hard to maintain physical spacing and COVID is circulating, I think there's reasonable evidence to justify use of non-medical masks in those circumstances. Even in those circumstances, the primary deterrent for transmission, though, is the physical distancing. Personal care services as an extra precaution because, and that's what I mentioned, I think, at the last media update, it's pretty hard to do many of the personal care services without being in very close contact. At the same time, this is a non-medical interaction, so it's in a different sphere of regulation and guidance from a medical interaction. And therefore, as an extra precaution, where that 2-meter distance can no longer be maintained, so you're coming around to the front as part of a haircut or doing nails or something, then we ask clients and the provider to wear a non-medical mask just as an extra precaution, and really to protect both the person providing the service and the client.
And our last question today, are businesses expected or required to enforce physical distancing measures in their establishments? For example, should non-complying customers be asked to leave?
It's a good question. It comes back down to that philosophy that we've been speaking about throughout this whole experience, and that is that physical distancing, extremely important, part of keeping yourself and others safe, as Dr. Hanley just went through. But it's one of those responsibilities that falls on each and every one of us as individuals. So the onus there being on the individuals to keep themselves safe by keeping them distant. I got to say the businesses have been doing a wonderful job. They all approach their operational plans in very creative ways, interesting ways, and I commend them for going above and beyond to keep Yuconners safe. We see signage. We're seeing hand sanitizers, extra cleaning and even washing in between before you get into the store, throughout the store visits. I'm extremely impressed with the efforts that the business community has made to, like I say, go above and beyond the recommendations. So, give them the support they deserve by all those extra measures when you're visiting people's stores. Don't lose sight of the fact that the responsibility is on you as an individual to keep others safe and to keep yourself safe by practicing Safe Six and by practicing the social distancing measures when you're out shopping in our communities.
Yeah, I have to say I agree, and I agree with the amount of work that have been done by businesses and establishments has been just extraordinary, and that work is what's going to keep us out of trouble when we get further introductions of COVID into the community. So that's what prevents a case from becoming an outbreak, and it is so important. I think, again, I tend to lean more heavily on the education and information side. Really set the standard and just keep reiterating. Enforcement plays a role, but I think as we go forward, likely we need to see it playing less and less of a role as this becomes more and more inculcated in us as our way of life for the time being. And I think in terms of should non-compliant customers be asked to leave, for me it really depends on what is the level of uncooperation that is occurring. Is this a matter of a gentle reminder, or is it a matter of someone that might be posing a risk to others, and therefore other policies will kick in? So I do think it reminds me of a conversation I had with Dr. Elliott just yesterday, and we were talking about maybe the need to get better at short of enforcement, but just being better at reminding each other of when we need to just back off a little bit, or just let it be acceptable to remind others of the need to safely distance. And I'm often a culprit myself and need that reminder that okay, just respect that safe distance, and because these are new habits, we all need to be reminded of the need to do this.
Thank you very much, Premier Silver. Thank you very much, Dr. Hanley. I would also like to acknowledge our ASL interpreter, Mary Thiessen. We introduce everyone else, but we often forget to introduce Mary, so thank you very much. I'd like to thank everyone for joining us today. I'm now going to hand it over to Cam Heek from the Executive Council Office, who will try and facilitate questions from the reporters. Our next COVID-19 update will be Tuesday, June 2nd. Thank you.